So I was left with the pain doctor and another specialist rheumatologist for the body tissue and muscles. So now they had to go sit down, go through my record one by one. That is when now the doctor came, this rheumatologist, and he told me, we've gone through your records, and now whatever you're having is a condition called fibromyalgia. So hata mimi sikuwa najua fibromyalgia ni nini. Hapo ndo nilijua. But now they came in with even the breast doctor and now a counselor.
So what is fibromyalgia?
So fibromyalgia is it's a long-term chronic pain condition, and it's characterized by widespread of pain. It goes pole, but you get to a point your whole body is in pain, your muscles, your tissues, that's it.
Saseni, welcome to Cele's Reflection. It's another Wednesday. Thank you for reaching out, guys. Thank you for sending your requests. Thank you for sending your proposals, your ideas of topics you think we should cover. I am truly, truly humbled. Asanteni sana. So today we have another episode from one of us who was watching. I feel there's need for her to come and maybe share about her journey, share her story with us. At least we get to learn. So today we are learning about, personally, I'm learning about something very new. I've never heard of it. And that's why Jackie is here today. Jackie alinitumia email. Jackie, thank you so much. Okay. Thank you even for taking time to send an email so that you can come and share your story with us.
Thank you.
So introduce yourself, then tunaweza anza.
Okay, my name is Jackie Kiruti. And I'm happy to be here. Thank you for returning my email. I'm really grateful. The reason why I'm here is because I want to share my story and create awareness. It's about a rare disease. It's called fibromyalgia. And I would like to tell my story because people don't know about it. Yet there's a population that lives with it's in a group of rare diseases. It's one of the rare diseases, but people don't know much about it.
Yeah, and I think we are lucky, Ama. It's such a coincidence that you're saying this month. It's the month of May.
Yeah, we create awareness about fibromyalgia, and there's also another rare condition. It's called lupus. It's also both of them. We create awareness this month.
So maybe to take you back, is it something? It's something that you've known because of the story. It's something that you knew.
About fibromyalgia?
Yes.
I have it. I live with it. Maybe I can start where exactly all things started before now we go to fibromyalgia. And everything started back in 2013. I was still in campus. And I remember it was October. It was the cervical and breast cancer awareness month, and we were in campus. But before that awareness, I had like lumps on my breast. I could actually feel them physically, and for me I was like, maybe it's part of growing and they might go away. So I was just taking it lightly. Then I shared it with my friend in campus, and she was like, since it's they are doing the screening, why don't we go? And I was like, I was actually going for the sake of going. I wasn't that serious or very intentional about it. So when it was, you start with breast screening, then there was cervical screening. So when I went in, the screening was being done by sisters, Catholic sisters. And after they do the physical examination, and I saw her calling another sister and another sister. So I was like, wait, something is bad here. Then they were like, I think you need to go and talk with the university doctor. We're just giving him a call. They told me, you have lumps on your breast, but the doctor is better placed to explain it for you. I was actually very scared. When I went to the university doctor, he was like, you have lumps on your breast, and the fact that you can feel them physically, they might be big, but he was like, there's something called fibroadenoma, we can't say that these lumps are cancerous and we can't rule out. So the best thing is you go get he recommended a test that I need to get done. Then from there I might know what it is. But that time I was schooling in Nyeri, so the hospitals there didn't offer such a test. So it was like, you can go to Nairobi Hospital or Aga Khan. And I was actually scared. We were actually doing exams, and I think my brain ilienda to flat. So I was like, you think on the worst side. I was like, maybe I have cancer. Why am I even studying for this test and everything? So in December, I came home. I shared with my family. They were actually also scared. It was not such a good Christmas season. And in January is when I went for the test. But he had recommended a test called FNFI needle assessment, where they prick the lump, then they do the analysis to check the nature of the cells that are in that nini. But before that, I went to a doctor, and he was like, before you even get to that test, let's just do the normal ultrasound. So we did the ultrasound, and for me, I thought I have one. Actually, they discovered I had like 3 on the right side and also 2 on the left side. But they were like, they were consulting there, and I was there. Then they told me, the fact that we are laughing, it's not something bad. So I was like, okay. That's when now they explained it to me. They told me there are things called fibroadenomas, and they are very common, especially when you're still growing. They were like, they are not cancerous. They can go away on their own. So they're like, we don't even recommend surgery, because the moment you start disturbing them, they might actually become aggressive, multiply, or grow inside. So they're like, based on this ultrasound, the size is not even that wanting. They're like, sometimes they grow bigger, and they're called giant fibroadenoma. When they get to that giant fibroadenoma, they don't even ask you. They have to remove them, because it might pose a risk of getting breast cancer. So I was like, okay, I'm okay. And I went back to school. Yes, I was okay now. So I was still in school, and I was okay for some time. But now my concern was I started feeling pain. They started becoming painful. So that now was also another concern. Now, after like 2014, I was not worried. Then towards the end of 2014, now I started feeling the pain, and I was saying like, it's because maybe it's cold here and everything. But yeah, after some time, I went and saw a gynecologist in Nyeri. Then he was like, he told me the same thing about fibroadenoma, but he could not explain why I was in pain. He was like, these things are never painful. Then I think I shared with my elder sister, and she consulted with some people, and she got a contact of a breast specialist at Aga Khan. So she told me, there's this breast specialist, you need to go and see him. Just to clear the air. So I came from Nyeri, I went to Aga Khan. I think it was my first time in Aga Khan, and I was really confused and lost. So when I got there, I was actually shaking. I was very worried, and this doctor was actually very friendly. He was fatherly. So he was like, I see you, and I see my doctor. He's Professor Wasike. He's retired now. So he calmed me down. Then we started talking. He was like, I had done some ultrasound. So he was like, there's no need of taking you through ultrasounds, because it's not past 3 months. So he was like, yes, these are fibroadenomas. You don't need to be scared. We cannot remove them. He told me, you're too young to start putting cuts on your breast. He was like, I'm not going to do anything about them. Let's give them time. They may actually disappear on their own. But I told him now I'm in pain. He gave me some pain medication. But he also told me maybe it's because of the cold weather. You need to have like a hot water bottle. You need to be sponging with like a hot towel just to calm them. And I went back to school, and I finished. And he recommended that I do follow-ups after like 6 months, just to see if they are growing or reducing. And I did it for some time. Then I was like, everything is okay. I went back home. I'm from Narok, so it's a bit warm, and I forgot about it completely. And everything went well until end of 2019. I had gotten a job, and I was posted in Mombasa. Then I was like, I was feeling some pain. Then I was like, maybe it's the change of weather. I'm used to this environment. Now I've transferred. But now come 2020, when now COVID hit, the pain now was now getting intense. There's a day actually I was sleeping and I could feel pain on my chest. It's like they've put weight on your chest. I couldn't even breathe. And that season was COVID season. So the first thing you think of is COVID. But I knew now because I had felt the pain for some time. I was like, no, I need to go and see a doctor. Mombasa, they also don't have like a breast specialist. So the best you can get is a gynecologist. So I went to a gynecologist and he was like, I gave him the story, my history now, and he was like, now we need to do a test to see the nature of the cells that you're dealing with. For him, he didn't do ultrasound, and I don't know why. So he based, he was like, I can feel one lump. The one that was big now, you can actually feel it. So he was like, we need to to take the sample, then we see what you're dealing with. And how they take that sample is another thing, because now the test, it's now the FNA. They use long needles, they press you down and get the samples. And remember, this is like a solid thing. So they have to prick it kwanza for them to be able to aspirate. And now they sent me to the lab to do it. And the guys who are doing it, they told me, I hope you know this is not a procedure. It's just sample collection. So there is nothing we are giving you for the pain. We're not numbing you. So just like that. So I was like, okay. They tried. It was actually very traumatizing. Now you have to wait for, I think, 2 weeks, because they had to send the samples to Lancet. And those 2 weeks were just hell, because you don't know what you're dealing with. You don't know what will come out. Then after 2 weeks, I get the results, but the people from Lancet said that they cannot give a conclusive report because the sample aspirated was insufficient.
Oh no, after all that pain.
Yes, so they were like, we are not going to charge you any money, but now instead of the hospital collecting the sample, you'll go to the Lancet. They aspirate the samples the way they know best.
So all these people are in Mombasa?
Yes, in Mombasa. So they told me, I know it was painful, so we are giving you time to recover from the other one.
So that
they told me, like, come after a week. So I went there and it was bad. They took like 2 hours. And ni wanaume wanakushika.
Then there's no like numbing.
There's no numbing. It's the same thing. It's not a procedure. It's sample collection. And they're like, actually, they told me, we are really sorry. This is going to be painful, but we need to get sufficient sample.
Okay.
They put you down. Ile mpaka wanakwambia haya, breathe kwanza alafu tuendelee.
Oh no.
Yes. So now they got sufficient samples, and I got the report. The story was still the same. It's fibroadenomas. There's nothing to be scared. Like they are not malignant. So I was like, okay, now I'm not dealing with cancer, but there's nothing that was relating as to why I'm in pain. But they told me, now I went to another gynecologist with my report.
Sorry. So normally, these lumps, they don't have pain. They're not supposed to make you
be painful.
Being painful.
Yeah, actually, they say in every 10 women, 8 have them. It's just maybe because you don't go for screening. It's something that doesn't disturb you. So very people actually might have them and you don't know.
So the lumps will just come at some point, they disappear.
Yeah, they disappear.
Okay.
Especially as you grow old, they disappear.
Okay.
So I went to another gynecologist, and he was very frank, and he told me, I'll be very honest with you. If you keep going to gynecologists like me, they will send you to theater. So the best advice I can give you, when the country opens, you remember that time Mombasa, it was locked down. He told me, when the country opens, just go. Since you have a breast specialist, go back to him. He's in a better place to guide you.
So now you're in Mombasa, there is lockdown, so you are alone, not
Yes.
even with your sister?
Not even, no family member. I was working, but I had very good and very supportive friends.
Okay.
So I didn't feel like I'm alone in that journey.
Okay.
So when now I came to Nairobi after the country had opened, I just went home. It was not on top of my list. So I went home, I stayed there, and at home, I started feeling the pain. So I was like, okay, maybe it's because home it's a bit cold. But I didn't sleep for like 2 nights. So I just told my parents, I'm going back to Nairobi and I'm going to see a breast specialist because I just told them what had happened. And I called the doctor and he was like, yeah, there's a clinic, just come. So I went. And I was alone. I didn't even ask someone to accompany me. Yeah, but what was actually taking me there was now, why am I in pain? So when I got there, the doctor was like, hey, long time, how are you doing? What has brought you here? It's been a while. I thought actually things are okay. Things were okay, but this is what has happened. I told him that we had done scans, but now I'm in pain. Then he was like, let me do physical examination, then we can know what to do. When he did the physical examination, he was like, I've been telling you there's no surgery. Now we have to do it.
Why?
I thought I had 1 lump, but there were like 4 on the right side, then I think 3 on the left side. So even the person who was doing the physical examination in Mombasa he couldn't detect, but this now is a specialist. So he told me, what I need you to do, I need you to go for an ultrasound so that we can see what you're dealing with, but just know you're going to theater now. I'm not asking you, I'm telling you. So
that we can remove the lumps.
Yes. So when actually he even called the radiologist, was like, this is urgent, I need the report back. So when we got the report, he was like, you see, based now on the previous ones, they had started multiplying. So he was like, now we have to remove them. And he was like, no, it's very simple, don't worry, I'll do. You won't even see a scar. Then he was like, and I'll do on both of them.
Remove the 4 and the 3.
Yes, at a go. So I was like, okay. For me, I was like, I think so. All of us thought that the lumps were the ones causing pain. So I was like, even after the surgery, now I'm done with the pain issue and everything. So I started preparing, and I went to our office at the headquarters. I told them we cleared with the insurance, and now I was ready for the surgery. And he told me, actually, he had said, I will do the surgery and you go home the same day. And I was like, hapana daktari, I think it's best I just stay in hospital even for a night to be observed. You don't know, because I'm in theater, you can't just send me home like that. Then the procedure, now when he explained to me, he told me, because the lumps are located in different places. It was here, huku chini, huku kando. It was like, I can't cut where they are because I might mess with your milk ducts. Then when you start breastfeeding, it got blocked. That will also be another issue. So he told me, what I'm going to do, I will cut around the nipple, then I will maneuver around. Sasa nile kuchokora kuzitoa moja moja. Then he told me, if now it becomes complicated, is when I'll have to cut where the lump is. So thank God he was able to do that one for cutting around the nipple, and the surgery was a success. It took more time than whatever he anticipated, but everything went on okay. I slept for 1 night, and he gave me painkillers, so I was not even in pain. If you had visited me, you couldn't even know I was in surgery. So the next morning, I am discharged and I go home. Do you know what they gave me for pain? Paracetamol.
Like the normal
painkillers? Yes, Panadol unanunua tu kwa duka. So I was like, this is what you're giving me? Then they told me, you'll come after 3 days. We dressed the wound and everything. There's no touching water. So I went home. The first night was easy because they had given me strong painkillers, kina morphine. When now iliisha, and no, sasa, both Sasa imagine both breasts. So huwezi lala hivi, ni mgongo. I was kneeling down. Iyo paracetamol haisikii. So I called the doctor. He was like, come. We dressed the wounds. They were healing okay. There was nothing to worry with the wound. So he gave me now strong painkillers. They are tramadol, the controlled ones. He told me, take this medication on a need basis because there's that aspect of dependency. And hizo siku tu naenda Aga Khan. One day, I was with my brother. So we saw a place imeandikwa pain management. So we were asking ourselves, kumbe there is a place here, pain management. So in our heads we're like, in watu wa cancer.
Like
now I didn't know that later I'll be part of the yeah. So it was actually, the healing was actually very ugly. It's very, breasts are tender, they are sensitive. Now there are stitches there. It was actually, the healing was ugly.
How long did it take for healing?
The surgery happened in October 20th. The second week of January is when now I could say the stitches have healed completely, because it took time.
So you stayed on these painkillers for how long?
On a need basis. You don't take like every day.
Yeah, when there's pain you take.
Yeah. So
for how long?
Till December.
From October?
Yeah, kidogo too, not every time, because I was not working. So you could push yourself kidogo, because now you've been told these things, they cause dependency.
Yeah, they do.
You don't want to have withdrawal symptoms. So now I even had to, but the doctor told me, now you need to look for a transfer to come to Nairobi, because now you need close observation. I was in Mombasa, so I had to process my transfer and come closer to the doctors, because in Mombasa they don't have the specialist. So I came to Nairobi. I was still, now there was some pain, but it was manageable. And the doctor had told me this thing is going to take like 6 months
to heal.
Yes.
From the surgery.
Yes.
Not the lumps. The lumps are completely
off. They've been taken, and they were taken for histology to just check the nature of the lumps, and they told me that they're not cancerous. So that was like one thing. But the waiting season also, before you get the result, you're like, wait, what will come out of that? But I wasn't very scared, because they had tested something. Now I was looking forward to the 6 months. I was actually counting. I came to Nairobi, and things were a bit easier, because now I'm closer to my family. And we started doing away with the painkillers, and I will take just supplements, evening primrose, and vitamins. And I was okay. There was some pain, but not that much. So now I knew in April is when I'm hitting the 6th month. So I was really looking forward to April. And by the time we're getting to April, the pain had actually reduced significantly. But you can't say that the pain has gone off completely, because if there is weather change, any person who has done surgery, at some point you feel the pain. But I was okay, actually. So I was okay, and I remember that time, I think the doctor had gone out of the country, and he's the one who advised me. He told me, what you need to do, you don't need to have like one doctor. You need to have like another doctor. In case one is not there, you can go to someone else. So I looked for a doctor in Nairobi Hospital, and I would go, and now I started now experiencing the pain again, and now it has healed. So I raised it with him, and he was like, what we can see, I had done an ultrasound, I think in January, because I think the doctor was a bit concerned why I'm still in pain. So once we did the ultrasound, what we found out were the place where the lump had occupied, there was it was filled with fluid. So it's more like a cyst. So the doctor told me this cyst could be why you're still in pain. Now that part has to be. He told me the body is going to heal it on its own, but we have cases where the fluid doesn't go away, so we have to keep on removing them. Let's just give it time and see. So I was like, okay, now I knew the cyst could be the ones causing the pain, as I'm now healing. So when I went to see this other doctor, now my second doctor, it was like, he started talking things. I was like, He started telling me, just be on primrose now. But if the pain continues, we might need to induce early menopause, because now he was associating it to hormonal imbalance and everything. But we had done tests on my hormones, and there was nothing concerning. Then he mentioned something that sometimes the result cannot be very accurate. But he told me he's very hesitant to do it. Let's just wait. And I was okay. Then I started feeling pain. But now I was like, hospital is not a place that you want to go every time. I was actually postponing. It's like, even my friends were like, did you go to hospital? I'm like, I'm managing. There's no need to go to hospital.
That is after April, like after all the pain, the surgery pain is over.
So one day, nimetoka job, nimeenda kwa nyumba, I've cooked, but I didn't even eat that food.
You were in pain.
Pain attacked me. Cele, my right side, even lifting my arm was a problem. I couldn't breathe. So the first thing you think it's COVID. But now this pain, like my right side was in so much pain.
And we're in 2021 now?
Yes, in 2021. So, of course I cried. I didn't know what to do. I had taken the over-the-counter ibuprofen, paracetamol. But now it attacked like the right side, I was in so much, even my chest, it became cold kabisa. So I called the doctor at around 3 in the morning. I told him, Daktari, mimi nakufa. Then he was like, I told him I'm in so much pain. I couldn't sit upright, I was sitting like this. So he told me, come to the clinic the first thing in the morning. That day he didn't even have a clinic. But he was actually concerned, why are you still in pain at this time? So when I went, he told me, externally, you're okay. So let's do an ultrasound and maybe see what could be causing this pain. So he did an ultrasound, and when he saw the results, he told me, like, this side, it was black. It's like I didn't have supply of blood. It was inflamed. So he just called me and told me, I remember it was on Wednesday. He told me, now this is beyond me. I'm a breast specialist, and I want to send you now to the pain management, because it's like now the pain was amplified. So he made the call to the pain doctor, and I was to see him on a Friday. He didn't go to the details. What he told me, I'm not even going to waste your money prescribing any medication. Just go home Thursday, come and see the pain doctor. He's going to start you now on the pain management process. So I was actually very confused because I didn't know what pain management. I didn't even know there's a pain specialist.
I also didn't know. I just realized that now. And he didn't give you any painkiller on that day?
No, I had some, the ones that I was to use on a need basis. So he told me, if you have them, you can take them. You wait for, it was Wednesday, so it's just Wednesday night and Thursday, then I go. So for me, I went home, but I was still curious. Actually, I felt it's like I have COVID. So what I did, I went to the clinic at Capital Center, Aga Khan. And I told the doctor, I'm yet to see a pain specialist on this day, but I feel like I have COVID because the pain was too much on my chest, I couldn't even breathe. So he went to the system, we checked the reports, and he told me, I don't want to waste your money. Just go home, tomorrow go and see the pain doctor. So I told my family, I'm going to see the pain doctor. Everyone has now questions. What are they going to do? Who is this pain doctor? I was like, I don't know. I'm also going to find out. So I went there, and of course, there's always an issue because with most insurances, they don't cover pain management. So the first time, my insurance was like, there's back and forth before they accepted, but they did. So you stay there. And when you go for such clinics, you need to carry a bag of patients. Because I was told I'll be there at 2, I was being seen at 6
p.m.
Yes. So I went in there, and when I was dealing with I think the clerks there, they made a comment like, you can't be seen by a doctor until you pay first. So I was like, who is this selfish doctor who cannot even see you? And they know that you still pay. But when I met the doctor, he's one of the best people I've ever met. So he explained it to me. He did the examination, even touching my body. Cele atikusema utoe bra for the examination. It was hectic. I couldn't even move. He told me, you're in a lot of pain. And now he had read my history. So he was like, the pain has spread to your rib cage and everything, and the back. So he told me, we are going to start pain management. He just told me in black and white. I can't tell you how long this is going to take. It's a journey. But what I do promise, I will walk it with you. So he was like, the first thing we need to do is try and localize the pain. So I was like, okay. He gave me medication, gunia mzima, unabeba. That time I remember I had to even take time off work. He told me he told me, don't follow what the pharmacist say. They'll tell you take this 3 times a day. He gave me a timetable. You had to wake up at 1 a.m.
Ooh.
3, you take the medication. There were so many. Yani unabeba the biggest bag. And now it was like every 2 weeks, you have to come and see me. So I started those medications. They have their side effects. So you can't even go to work. Now all these drugs that he's giving you, they're controlled drugs. They're not drugs that you can just find over the counter. Yes. So they had so many side effects. You can't sleep, your stomach, you start having irritable bowel syndrome, your skin, you can't sleep, you have insomnia. And most of these medications, they cause drowsiness. So I had to take time off. And I remember I stayed off work for like 2 months. Just on this medication, 2 weeks review. And I think after 2 months, the doctor suggested that I start physiotherapy because my muscles zilikuwa zimeanza kukua ngumu. So it hinders even the supply of oxygen. Mm-hmm. But now when I started interacting with this doctor, I remember I even asked him, of all the fields in medicine, why did you even choose pain? Nobody comes here with any good story. Mm. Then he told me that he had seen a lot of pain and he felt like walking the journey with people with pain, it gives him fulfillment in his nature of work. And he's a very reliable doctor. And I remember the first time I saw him, he actually gave me his phone number. I was like, Allah, which doctor? You know, when you ask for their phone numbers, they tell you call the clinic, they will inform me. But he told me, here's my number, you can call me anytime. So I was like, we started now creating a rapport. And he told me that this journey might be ugly. So I remember there's a time I called him. I was in so much pain. You've taken this medication, but you're still in pain. So I called him. I told him, Daktari, mimi naona ni kama naenda. Then he told me, come to the clinic. He's a very calm person. Then he told me, and now he started now demystifying what is this pain. By that time, we still don't know if you're dealing with fibromyalgia and isovitu.
Yeah, you don't know whether
we don't know yet. So he told me, let me tell you one thing. There's no single day pain will kill you. Hakuna siku utasikia so and so died because of pain. It is what that pain does to you that can kill you. He told me, your mental, you need to be very cautious of your mental health because pain can make you now commit suicide. He told me about the drugs. He told me, these drugs I'm giving you, if by any chance you overdose, you're gone. And he also told me the other thing that can kill you is not if the drugs that you're taking, they affect your organs. Then you start having organ failure. Those are the things that can kill you. But pain will just mess up with you, but it will not kill you. So he told me, you need to take care of your mental health. I was like, okay, you know, some things you hear and you're like, mental health, you don't even want to go for counseling. I was like, okay. But he does very good with talking, and he's one doctor who will not tell you, wewe hata una uchungu. Wewe unajua ule ametoka hapa ako na uchungu. He acknowledges your pain and everything, and he'll tell you, now pain can do this and this to you. When you see this happening, this is what you can do. And for him, he told me, for him, as much as we don't know how long this pain is going to last, he will try and give you techniques of how to continue living your life despite the pain. So I was still taking medication and everything. Then one day...
Have you started with your physio now? Are you still doing both?
No, I had not started on physio because I was in so much pain.
Okay.
So he told me, let's wait first of all, the pain to go down. And now this is, I think, around July. There's so much cold. He told me even the cold weather doesn't work well with pain. So you just have to keep warm, use the hot water bottle. Then maybe from around August is when now we can start the pain management. So I was at home, relaxing, taking my medication. Then I remember we lost a loved one that time. So when we lost this loved one is when now I started getting calls from people. Oh, nilikuwa nimesikia ulikuanga mgonjwa. Unaendeleaje? So I was like, oh, kwani mmefikiria mimi ndio next naenda? People had not even called you when you had the surgery, but now because someone has died is when now they remember and so alikuanga mgonjwa. So that thing, it made me mad because I was like, for me, I show up for people. If you're sick, I will come see you. So I went to hospital and I was very frustrated. The doctor asked me, why are you mad? I told him, imagine after someone has died is when people are calling me. Then he asked me, why are you mad? I told him, because they didn't call me when I was in surgery, but now they're calling. Then he told me, calm down. I was like, okay. He told me, these people, who are they? I told my friends, my family, I mentioned. Then he told me, have you ever sat down with them and told them, if today I become sick, Cele, come to hospital, you have to come and see me, bring me flowers, be calling me. I told him, no, but it's supposed to be that way. He told me, where is it written? I was like, nowhere. Is it? He told me, one thing I want you to let it sink. Nobody owes you anything, including your own mother. Nobody owes you. If they show up for you, it's out of their kindness and love. Appreciate it. If they don't, life goes on. I was like, don't expect anything from anyone. Your expectations will hurt you, and you need to take care of your mental health. Took time. Took me like 3 months to just digest what he told me. Nobody owes me. So, but when it sank, it's a game changer. Like, okay, amekuja kuniona sawa. Hajakuja, maisha inaendelea. So I still continued with my management. Then I started now physiotherapy. Umeamka asubuhi unaanza kwanza kulia ukijua unaenda hospitali. Because unaenda unafinywa and it's around the breast. Hawakuhurumi. So I used to be given like a corner room. Ile uko ndio hata ukiscream ausumbui watu wengine wako huko. I would wake up and like, oh my God, I have to do this. I remember I did it for 2 weeks, but they were really necessary to just try and relax the muscles. Then I continued with my pain journey, but now things were we had tried to localize the pain, but now the intensity of the pain was increasing. So we had now to continue now upgrading the painkillers, and these are strong painkillers. So I remember now, by this time hata insurance ilishaisha. So you're digging into your pocket. Now that is when I started feeling the heat of pain management, because it's very expensive. You go and you have to do like clinics after every 2 weeks. They cannot give you more drugs than 2 weeks. And dawa peke yake, it's around 30K. Ujahesabu, maybe you can't even drive there, so you have to use an Uber. In your own house, now you are starting to be limited. You can't do the things you need to do, so you need to pay someone to do it. At work, you also need to be in and out, so you're not very consistent. But now we started now using, I remember we had started using a drug called oxycodone. At that time, 1 tablet was 840.
A tablet?
Yes. And you need like 4 in a day. And you're not taking the oxycodone peke yake. There are others. So unabeba dawa hata ukitembea kwa street, afadhali uibiwe simu lakini dawa zako ziko. And these drugs, if they get into the wrong hands, they're actually very abused. Right now, like in the US, they've banned that oxycodone. Haiko. So we started taking the medication, but now the pain is getting worse. So around December, the doctor suggested, he was like, maybe there's something I'm missing out. I need to send you to a neurologist. just let's see what she has to say. I went, and she was actually, are you okay? How did you accept to do both surgeries at a go? I was like, I didn't even know. But she was like, everything is okay. She couldn't relate like what could be causing the pain. So she was like, she added another painkiller that helps with the nerves. You know, painkillers, there's a muscle relaxer, there's that one for nerves, then there's now the other one that blocks the general pain. So she was like, let me add this one to whatever the doctor has given you, then take a month, and you come back in January, we see what's happening. So I took them. Now, even going home, you can't stay for long. She said like 2 or 3 days, then you're back to Nairobi. Because this pain, any change in weather, traveling, it just flares up the pain. But now I'm in this very dark place because this is something that you're not prepared. You don't know what this thing is. I remember right now looking at where I am and that time what I was calling pain, I'm like, ilikuwa mchezo. I remember there's a day I was like, I'm just done with this thing. And I told God, now I want to die. And actually I was actually very tempted to overdose, and I was like, no, I'm more than that. So what I did, that pain, unaenda kitanda haukai, unakuja kwa kiti, unajaribu kulala kwa floor, it's not working. So I was like, what I'll do, I told God, you allowed this to happen for a reason, so I will just sleep. If you take me, I'm ready. And I slept. Then the next day I woke up, I was like, ala, bado sijaenda. So I was like, that gave me a sign that God is not done with me. So we continued with, but here in between November and December, the doctor introduced me to a program. He told me that if you interact with the doctor, his working is very different from other doctors. So I was curious. I was like, why are you so open? You share things, you're very reliable. Then he told me there's a program I attended, and it changes the way you view life and how you do things. Then he told me after I did this program is when I was able to be there for my patients with pain. Then I was like, I'm curious. Is it like a medical program? He told me, no, anyone can do it. And he was like, what I'll do is like an introduction. You just come and listen to the testimonies people have after doing the program and everything. Then you decide if you're going to do it. So I went in and I had people with issues, just mental issues. Actually, I learned that as human beings, we carry a lot of trauma in us. And if you don't address these traumas, they manifest. So he told me this program will equip you with knowledge and skills that will also help you work out things in life, not just your pain aspect. Of course, now pain is a new thing that is coming into your life. But there are other aspects of your life that you need things to be working. It can be your relationship with your parents or any other relationship. It could be your career. It could be finances. You have a way of making things work. So I was like, okay, just go there with an open mind. And after that program, even the conversations you were having was on a different level. And I remember when you go to that program, they tell you, what do you want? As in, what are you coming to the table with? So I remember for me, I was like, I need to be very authentic with myself, because we actually learn that even us ourselves, we are not authentic.
So let me ask you, Jackie, sorry. So now this doctor is treating both pain and also like the mental health side of it. Like you can discuss other things on how
but actually later is when now he was like, you need to go for counseling. But actually when you go for this consultation, it's more like checking on your mental status, acknowledging what pain is doing to you and how you can manage it.
You're still in pain?
Yes.
You're still taking your painkillers?
Yes.
Then you're still seeing this counseling bit side of how I'm feeling as a person?
Yes. He does it. I even tell him he does it so well. He can do. Actually, there are days you go there and you're like, daktari, leo staki maneno, niandikie dawa niende.
I'm in pain.
Yes, staki kusikia, staki motivation, we niandikie dawa niende. And there are those days you're like, I need to talk. And now that's when I understood why the consultation takes time, because it takes like an hour with you.
Apart from the pain, but we still check on you as a person.
How is it affecting your life? How has it affected your family? Sometimes you might go and say, someone said this to me and it triggered this. Then he'll be like, is it because of what he said? Ama because you know you're in pain, so you get offended when someone says something, and maybe it's even out of a very clean place that they're saying this thing. So when I did this program, I went with two things. Number one, I need to be authentic with myself. And number two, I want to learn how to communicate effectively. So when now after the program, I remember the doctor was just testing if now I'm putting into practice what we learned, because actually he does the program with you. He's there to support you. Once you do the program, you become like an alumni. It's a continuous program. So the first bit of this program, it's about you as a person. You deal with those traumas, the things that maybe you didn't address, maybe there's a misunderstanding, you don't even talk to your brother or your sister, but you go back to those roots and find out, why was I not talking? Because someone told me something, but you didn't get to hear his side of the story. So after that one, I was like, now things, you have to put strategies. Then you have to ask yourself, he told me, why I wanted you to do this program. It's because it's going to help you with pain. You have to be very authentic with yourself. Am I in pain? Yes. It is okay to stay in bed. Because before that, you're in pain, but you want to be this strong person. You want to go to work. You want to show people. You put that strong face, yet your body is not okay. So he was like, I need you to do this for your own good. Because he was like, I will not be there all the time to just guide you or maybe call you out. You're like, hey, you need to pace yourself or anything. You need to do it yourself.
So did it help, like, in any way?
Yes. Had I not done that program, I think right now I'll be very badly off. Very badly off.
Now it's been like 2 years and something.
No, no, because now before we hata bado hapa tujafika kuwa diagnosed na fibromyalgia. I'm just in this thing called chronic pain. We don't know what it is.
Okay.
So in January 2022, I go back to the neurologist for a follow-up. And now this time I'm in so much pain. I remember that whole week I saw like 5 doctors in a row. So I went to my pain doctor. He was like, I need to send you to a female pain specialist. Maybe me as a man, there's something I'm missing out. So I was like, okay. Then the next day I had to go and see the pain specialist. She did the assessment and she was like, there's nothing. It's just the pain. So I went to the neurologist and she was like, this pain, apana. Actually, it was too much. So she told me what we need to do. We need to do a CT scan. Maybe there's something we are missing out that is triggering all this pain. So still I don't have an outpatient insurance, but I have an inpatient. And now this time I had found another set of Indian doctors. They do therapy, the massage, the things they do, reflexology and everything. So I would go like 3 times a week. So I remember during this time of pain, I had talked with my doctor, and every day when my pain doctor asks me, I'm like, I'm in so much pain. Even now this oxycodone, it's not working. So the same week, now I was to do a CT scan. Outpatient doing the CT scan, they were asking for around 48,000. Mind you, I don't have a cover. So I had to like look for a cheaper place. But now they warned me, they told me we need to see quality pictures, the images, because we don't know what we are dealing with. It's like now we are fact-finding. But it was on a Sunday. I had not even found out a good place for the CT scan. Then I was going for my therapy on Sunday. Very early in the morning, we go at around 7, not eating anything. And after the therapy, I was like, nimefinyika kimfuko, and I know Sunday, Tao is not very congested. So I was like, instead of taking an Uber, let me save that money, just go to Tao and take a mat. But I was in pain. And I was like, hii pain hata kama niko naye, itanifikisha kwa nyumba. What I didn't know is the kind of medication I was taking, it makes you drowsy. But now I was like, I know, as in, it's not something that itakupata tu hivo, unaona pole pole. So I was like, I didn't know exposure to sun ina amplify. So mi nimetoka Aga Khan, nimeenda Tao. Do you know I collapsed in Tao?
Streets?
Yes. I was just walking and I can't even recount what happened. By the time najisikia, ni hawa the mamas who sell mtumba. It was just close to BS. Amenieka tu hapo kando. Yao walinichukua akanieka kando. But kuna watu walikuwa wameshashughulikia bag yangu.
Oh yeah.
My phone had gone, the money I had, but thank God they left the cards. So, I was now in this fixed place. And wiki that I've been going to hospital, I was actually in a fight with my family because I felt like they're not understanding me. They're asking questions that I don't have answers. Sasa sitaki hata mtu aniongeleshe. I'm like, I want to be alone. I remember even my younger brother came, akalala kwangu siku moja, nikamwambia enda kwako. I just need to be alone. And for him, he felt like I need someone. So this time, I've collapsed. My phone has gone. Sasa sahi niko mteja, hakuna mtu anajua mahali niko. So I just sat there for some time. I borrowed that lady the phone, and I made a call to my friend who had dropped me to the therapy early in the morning. And I told him, actually we stay in the same place. So he had some errands to run at Parklands. I told him, my phone may be one. But I had to think like fast. So I replaced my line. I had to go and look for a phone because my doctor is worried, my family is worried, nobody knows where I am. So I got my phone, and the first person I called was the doctor. I told him this happened and I collapsed. So he was actually, okay, so you need to come in tomorrow. So I called my brother. I told him. Then I went home. I was actually very stressed. I just went. Hata nikafunga curtains na nikalala. But now on the following day, very early, I went to Aga Khan and met this doctor. I went actually with my brother now. And he was like, now, you have to accept to be admitted. He told me, normally with pain, it gets to a point, your body is used to this oral medication, it gets to a point that it's not responding. And it's like, I feel like you've reached there because you've seen different specialists this past week, and we are not getting anything different. So it's best we admit you, and we do thorough investigation, what is happening to you. So I was admitted, and he was like, what you're going to do, you're not going to take oral medication. Now they had to manage it with kinamorphine, pethidine. Those are the drugs that you're taking. I remember when I was admitted, even other doctors will come and see me. You're the one who has been admitted because of pain. It's like, yeah. So they started the investigation. The first thing they did was like full blood analysis to check the organs, hormones. Then they did the CT scan. They did a breast ultrasound. And now we had to wait. Like the first 3 days, it was just specialists coming in, doing investigation. Then after that, they all came back to me, all the specialists, and each one told me. With me, the neurologist said in terms of my response and everything, the CT scan, actually, they were suspecting like maybe I have a cancer somewhere that is eating me. So they're like, there's nothing, your scans are clean, your ultrasound is clean, your blood work is clean. So there's nothing we can actually say that is causing this pain. So the neurologist akaniambia, me, I don't want to waste your money, so I'm walking out. Unless now you need me, is when you'll come and see me. But I'm not even going to give you like a follow-up. Me, I'm done. I wish you all the best. But she actually told me, you need to take care of your mental health. This pain is ugly. She told me that. So the breast doctor was like, in terms of breast, it's healing well. There's nothing concerning. So for me, we just do like the 6 months and that's it. So I was left with the pain doctor and another specialist rheumatologist for the body tissue and muscles. So now they had to go sit down, go through my record one by one by one. That is when now the doctor came, this rheumatologist, and he told me, we've gone through your records, and now whatever you're having is a condition called fibromyalgia. So hata mimi sikuwa najua fibromyalgia ni nini. hapo ndio nilijua. But now they came in with even the breast doctor and now a counselor.
So what is fibromyalgia?
So fibromyalgia is it's a long-term chronic pain condition, and it's characterized by widespread of pain. It goes pole, but you get to a point your whole body is in pain, your muscles, your tissues, that's it.
And nothing can stop it?
So they told me, so me hata sijui fibromyalgia nini. So I had seen it, you can see something on Google, but I'm like, I've seen the word, but I don't know what it is. Now they explained it to me, and they told me that sadly, there is no cure, or there's no treatment to this thing.
So up to date, you are still in pain, on painkillers?
Yes, we'll get there. So they told me there's no cure for this thing. It's just management. It's management. You take care of your diet, you do exercises. Importantly, take care of your mental health. They told me, I know it's a lot, but you need to start accepting that this is what you're dealing with for you to deal with it better. But that acceptance is not easy. You think that you've accepted today, then now, tomorrow I'm like, why me? So they told me that you'll stick with your primary doctor, the pain specialist. Maybe from time to time, based on his assessment, is when now you'll see this other specialist. So now we started looking for a painkiller that will help. Because you see, with morphine, the injection, it works very perfectly. Ukikudunga, after like 15 minutes, the pain has gone. But after 8 hours, it's worn out. And when it's worn out, the pain that comes back. So they were like, we need to find something that you can go home with now. And now, when they did the blood test, my liver was actually badly off because of the drugs. So they had to look which drugs are affecting the liver. They had to knock them out and put something that they know is not very harsh for the liver. So I'm here with my pain doctor now, finding something that can work. So the first thing he did, there's something called a morphine patch. It's just a patch unaeka hapa. But it's supposed to reduce the pain. So we started, I think, with 25 milligrams, 50, 75, 100. It was not working. So he was like, okay, this one is not working for you. Because had it worked, it would be better to go home with, because you just put it there and you go on with your business.
It's not affecting the liver. No. It's not.
One way or another, they're affecting, especially the stomach. So he was like, no, this one is not working for you. So he told me there's something we called pain blocking. You block this pain with steroids. So that time, my pain was on the upper body, especially around the chest and the back. So what they do when they're doing this pain blocking, they assess where you have pain, then you tell them where you feel like it's more painful. So for me, it was around the chest. So they use the longest sindano ile kama ile ya nini. What they do first, this was they inject kwanza the anesthesia. Then they do the blocking, but actually it's also very traumatizing. Una imagine sindano ikiingia hivyo, he actually doesn't enjoy doing it. He actually tells you, just look on the other side. You're making me feel bad, but there's no option. So we did it, and
so he does it on the chest?
Yes. And it was working. The first time we did this side, because the more pain was on the right, but with time now pain ikaenda ikakuwa kila mahali. And then these blocks, it was working then. So they did one, and I had to be discharged now with medication, pole. And I remember it reduced pain to a certain percentage. So I will take the medication, I would function.
How frequently were the blocks being done?
These blocks, you can only do them 3 in a year.
Oh, no.
Because they are steroids. So if you do them more, your body will not produce steroids. So it was like, we can only do them 3 times. So after these 2 weeks, now, you've blocked the pain. So when the medication wears off, it's like umefungia kitu. Inakuja. I remember after now the 2 weeks, I went back and I was badly off. I had to be admitted again. So he's now doing research on what else can he do. He's actually, we could see actually he's disturbed. What can I do to make the pain bearable? So the second time I'm admitted, he was like, there's this procedure that normally it's done for people with chronic depression, but research shows that for pain people, there's a way it works. It doesn't deal with the pain, but there's how it's like it flushes your system, medication can respond, you can sleep again. So it was like, I want to try one, then we see how your body will respond. I was like, whatever that you can do that is going to help. So he was like, he did it. He was like, it's called ketamine infusion. So this ketamine infusion, it's like basically you're going to theater. Ni vile tu hakuna kukatwa na kisu. They pump in the medication. You are knocked out for hours. Inaingia kwa system, then you wake up and the pain goes down. He mixes it with some painkillers, but you feel like umeenda ile massage, you feel you are lighter, fatigue imeisha, medication inaanza correspond even on reduced dosage. So it's like, let's just do one and see how your body is going to behave. And he's one doctor who actually cautions you. He tells you, when you are doing this, I want you to have an open mind, because it can work or not. This pain management, there's not like a standard way of doing it. It depends with your body. I was like, okay. So this thing is expensive. I think one cycle is around, that time it was around 75,000. One cycle. Because it's done in theater. So we did it. It was at night. And when I woke up, I was like, I feel like now a human being. I was even asking them, this is how you feel on like every day? So we did it, but now sadly, I started now having gastritis. So the ketamine had worked, but now this ketamine haitaki uwe na any other sort of pain. If you have any other pain in a cancel, it won't be as beneficial as it's supposed to be. So it was, but now I had started hizo pains za gastritis zilikuwa zimeanza. So I think they even had to keep me in hospital for a day just to make sure I'm okay. Then I went home, and I remember the ketamine ilinishikilia because for like another 2-3 weeks I would take the minimum dosage of medication and I would actually sleep. But now that became now my life with fibromyalgia, and just playing around with the medication. Then now we started now incorporating the ketamine just to break the cycle.
So you're okay to handle the gastritis?
No, we'll get there.
No, I'm assuming if you chose to use the ketamine, it's because now I can handle.
Yes, what they do actually, before they start the procedure, they give you medication for gastritis before. Then now they do the procedure. Then you're good to go. So that was around now June 2022, and I'm okay now. I'm dealing with pain, and now I started now becoming aware what this pain does to you. You're going for counseling just to make sure you're okay mentally. I also learned to communicate with my family. Now I was like, this is how it is. This is what I'm dealing with. There are days I just don't want to talk to anyone. I just want to be alone. So if I don't pick your call, understand. There are times I just need to be alone in my space. So if I don't want you to visit, it's not like from a bad place, just understand. And I also started now bringing my colleagues on board to try and understand what I'm dealing with. And unajua, the first time you're like, people are like, we know Jackie is sick, but we don't know what she's ailing from. But now when I started becoming open, they're like, this is what you're dealing with. And you're able to come to work, and surprisingly, I got a lot of support. So this time now, we are in June. So in June, I'm okay. I'm dealing with the pain, everything. It's just this confusing place. But now I know what I'm dealing with. I'm taking care of whatever I'm eating. I'm trying to exercise. It's that whole cycle. But now, the pain is now becoming aggressive. It was around the chest. Now it's moving. So I remember one day, I'm just sleeping in bed, waking up, I just feel on my leg, I started feeling like a burning sensation. So I even had to check everything in my bed. I was like, maybe nimeumwa na kitu. But there was nothing. So I just applied Vaseline and I was okay. After like 2 days, there's a blister. Kama umechomeka. So I was like, I didn't take it very seriously because it was not painful. And I was going for work in Mombasa. When I was now in Mombasa, your blister ikabust. So I was like, hey, I started feeling pain. But nile kidogo kidogo, because now your tolerance to pain imepanda. Sasa kuna vitu hata you're like, it's not too much. But the day I was to come back, Cele, mguu ilikuwa na uchungu, ikafura. Even walking was a problem. So, but I'm still taking it lightly. I'm like, maybe ni kitu tu iliniguza, nini. So, I went to my doctor for the review, for the pain review. And you have to tell, since when we left, what has happened, nini. So, we discussed the pain, everything. Then I told him, and by the way, there's this thing on my leg, nini. And he was like, let me see it. The reaction I saw on his face, I was like, he told me, this is not a by the way. This is something serious. Then I was like, okay. Now he was like, we don't know what it is. So he told me what I'm going to do. It was late in the evening, so most doctors had left. He told me, just go to the place they dress wounds. They dress it, come tomorrow and see a plastic surgeon. He told me sometimes when your body is in pain for long, you can get something, they are called like trauma wounds. So because we don't know what caused it, I have not been burned, we don't know what it is. Just see him to see the nature. Now, this is another trouble because it's affecting the pain management. So I mean, now the pain is now amplified zaidi because I have another problem now. So I didn't even see the surgeon. I think he was not there. And we had scheduled now this ketamine. Now we are doing ketamine like after 2 weeks or a month just to keep things in place. And thank God my employer had negotiated with the insurance just to cover this chronic pain. Most insurances, they don't cover chronic pain. It's very expensive. So I told the doctor, I don't have to be admitted. We now had to do like a daycare. You go in the morning, you do ketamine, then you go home. So this time we had slotted this ketamine, but I have an issue of the leg. So when now I had even, we were just about to start it, then I reminded the doctor, I didn't see the plastic surgeon because of this. So he was like, the wound where it was ni karibu na mfupa. So they didn't know how deep it was, and it was actually swollen. So he told me, let me call an orthopedic to determine if the wound has touched the bones, and now the plastic surgeon. The orthopedic came and told me, no, it's not, this is not an orthopedic issue. So the surgeon came and he was like, what we need to do, it had formed like a very hard thing on top.
That's where the blister was?
Yes, now it's a wound now.
Okay.
So they couldn't like know how deep it is, what it is. So they told me, you're going to give you a cream, you apply, to see if that top thing will be soft, then we can determine. So they gave me that one. It was at election time. I told them, I don't need to come to hospital like every day. It's very expensive for me. Teach me how to dress it. So I was taken through everything. I will dress it. And they told me every day, take a picture and send us so that you can see what's happening. So after the elections, we go back and it's like he told me, this thing, we cannot even scrap it off, so we don't know how far it is. He told me there are two things. Either you continue applying the cream, can take a year, but you don't know what's happening, or you do a surgery and do grafting.
Do you still get those pain?
Pain is constant here.
On the chest now? You still have pain?
Yes, pain is constant. That is constant. But now these other things, they're amplifying the pain. And now I couldn't even get my ketamine. So I'm not sleeping, I'm in pain. Medication is not responding. So I was like, let's go with the grafting. So we did the grafting, the healing, of course, because they had, I think it was very deep because they got the skin from around here, and up to date, I still feel the pain. They get skin from here, they put it there. But the healing was okay, and now it's just back to my pain management. Now, this pain management, I think by the time the leg is healing, the pain was way too much, not responding to medication. So the doctor was like, I need to admit you now. Instead of doing like one ketamine, we do like 5 of them back to back. So I was like, yeah, if it's going to help me, then I'm going to do it. So I was admitted, and now this time he was like, now I want you to see a psychiatrist. I was like, am I going mad? Then he was like, no, from time to time it's good to get an appointment with them so that we know how you're doing mentally. Then I was like, okay. Then now I had a session with the psychiatrist. Then I continued with my ketamine. But now my gastritis has now become too much. Because when you go for ketamine, they give you that injection that's supposed to last you for 24 hours. But for me, as long as I wake up from the ketamine,
They give you another.
no, I'm in pain. I'm complaining about gastritis. So the doctor got concerned and he told me, I think now it's time you see a specialist for gastro, whatever that specialist. Now this specialist came and they told me we have to do an endoscopy. I was like, you have to put something in my stomach.
Confirm, yeah.
Then they told me it's not even going to be painful. I was actually resisting. Then they told me it's not going to be painful and we will combine it with ketamine. Ketamine knocks you out. Ni kama tu umeenda theater. Now when you're knocked out, we can do it. So you won't feel anything. So I was like, it's okay. So they did the endoscopy and they found that the walls of my stomach are messed up. With now because of the medication. So they gave me medication and we had actually knocked out all the medication that can trigger, except now when they put the IV, the doctor used to combine diclofenac and paracetamol and now morphine. But now this diclofenac also messes up the gastro. But we didn't know at that point how bad it was. So I was given medication for the stomach. I took some supplements to detox the digestive system. No, supplements, and I was okay. We took care of the issue for some time and I was okay. Just this pain management that is now messing everything. Now I'm not going to work, I'm missing work so much. I'm not able, now I'm being more limited as a person because now pain is now moving to my back, to my joints. I'm not able to function.
Is that the pain?
Get here. So that was 2022. I'm not even able to go home. I go home like for 2 days and I have to come back. Traveling triggers it. Temperature change. It's actually the ugliest. Then we discovered, apart from now, the pain that is now spreading to all parts of the body, there's a sharp pain that comes to the chest. So when I raised it with the doctor, he told me fibromyalgia. Most people with fibromyalgia, they get that pain, and it's called costochondritis. What that means, where the ribs are joining here at the sternum, there is a cartilage. That cartilage gets inflamed.
Like you're all learning these terms.
I'm learning now, and you do a lot of research even on yourself to try and understand. You're in support groups, even in Facebook, so that you can understand what people are doing in other parts of the country, but it's still the same. So he told me it's called costochondritis. It mainly happens especially when there's a change in weather. Hot to cold, cold to hot, anytime you get it. So he told me there's no medication, but there are steroids they give. And he told me, to be honest, the side effects of the steroids are really bad. So I was like, no, let me just deal with the pain. I don't want to deal with others. Already I have so much of the side effects from this other medication. I don't want to add any other medication. Because when the pain increases, we are now increasing the dosage.
So now that you're being given the ketamine, your dosage is lesser.
Now, that was when we did like the 5 of them, we were hoping they will take me long.
Oh, yeah.
But that didn't happen. So they didn't last as much as we had anticipated. Remember, you're trying to deal with this pain, but it's also getting aggressive. And you're just blocking it. So it's increasing the dosage of the medication. Then this medication, you can't take them for long. So you have to keep on changing, alternating. Maybe you take this one for 2 weeks, then another one, just to make sure that the body is not used to one type of medication. So the pain is spreading. Now we are in 2023, and things got worse. Now I was in pain, and casualty became my home. At night, I'm badly off. You have to rush to casualty. They manage the pain kidogo. You go home and sleep. Pain comes again. Now the pain has become aggressive. And back in 2022, we did a second medical opinion, where the doctors in Kenya, you choose a hospital, they consult, they send reports just to see if there's something. And they were like, whatever the Kenyan doctor is doing is the best that can be done for this condition. So now gastritis is on another level. It's now an issue. Alongside this pain, now gastritis is an issue again. And 2023 was really hard for me because I didn't even go home. It was hospital. I was now working from home. But
so your employer is very...
Yes, they are very very accommodating. And they were like, yeah, when you're here, you work. So when you're not able to, just stay at home. And also now I'm trying to create awareness. This is what is happening sometimes, because there are times you wake up in the morning, your whole body is you're swelling. And it's just one of the side effects of the medication. You can't fit shoes, your clothes can't fit you. Now in 2023, this medication now that was a bit working better for me, oxycodone, there are two types. There's one called the prolonged release and the immediate release. This prolonged is one that I was using because you take one tablet, it inaenda kiwak pole pole for 12 hours. So during the day, you're like, there's something that is blocking that pain. So one day we wake up and this medication is not available. Not just at Aga Khan, but in the whole country. Simply because US and Europe, they are banning this medication because of the abuse. People who are using drugs, they combine with it. And actually, there have been so many deaths because of overdosing. So these two countries, these two continents, they are banning this medication and introducing medicinal cannabis as an alternative. But sisi huku Africa, we are suffering because we don't have an alternative. What was available now is the immediate. The immediate is one that you take like just any other painkiller. It works, but for a short time. With all these medications, you just don't wake up one day and stop. You do it slowly because of the withdrawals. So imagine you've gone to hospital, this medication is not there.
Like suddenly.
Yes. So you have to transition to the other one. I had a very bad reaction to the immediate one. There's a day actually I thought I'm going to die in my bed because it's like I got something like a seizure. I couldn't account for some minutes. Then I was having palpitations.
So it's like the withdrawal symptoms.
Withdrawal, and also this other one, I think it was a side effect.
Of the new one now?
Yes. My whole face had swollen. You couldn't even recognize me. So I was like, I have to go back to hospital. Now the doctor doesn't know what to do because this medication is not available countrywide. So I had to take time off work for this other one to start working. And remember, pain iko juu, and this one is immediate. So from 12 hours to around 6 or 8 hours. So you have to take it hourly, and it's not as strong as the other one. But now pole pole, mwili nazoea. Then I had to travel out of the country for work, and I got an opportunity now to do another second medical opinion about now this condition.
So once you learn how to take the meds, you know you have like 6 to 8 hours to do something. So even you traveling, it's because you know, ama how are you able to travel? Unameza,
by the grace of God.
Okay.
Yeah. But you learn how to take your medication, and also your body communicates. Number one, you're always in pain. The only time pain goes to zero is when you take something like morphine. So even when you take these oral medications, they still pain, but now you can tell inaanza kupanda. Okay. So the one thing you learn to do, you pace yourself. You know, okay, it's time to take this medication. But now the side effects, because you can just sleep anywhere. But I wasn't going alone to work. I was going with a colleague who's a bit of age, so she was more of a mother to me on this work duty. So after that, I did a second medical opinion. My doctor prepared reports. I shared with some doctors there, and they were like, what this doctor is doing is what we can do. There's nothing. Yeah, but now in Europe, yeah, they've legalized cannabis, which is actually more effective in managing the pain, medicinal. It's covered by the insurance. They support you. You take it, and that's why I think people there, they've managed to be able to deal with the pain. So when I came back, things got ugly. I came back in July. And
2023.
Yes, I had gone for like a month. So I came back, and pain is on another level. Remember, this 1 month, we've not done ketamine. And now the pain is going up. So we had agreed with the doctor, because now I'm away. And you can't just go to any hospital and say, this is happening. Especially if you have a pre-existing condition. They just treat things like emergency and everything. But you have this, so unajipanga. So we had agreed, if the pain continues, I just keep adding the doses. I was consulting him, and by the time I was getting back here, I had actually booked an appointment. It was airport, hospital. And the pain was bad, so he was like, there's nothing we are discussing. It's just admission. And I had to be admitted. This time round, I wasn't sleeping. The ketamine was not even responding. The first 3 or 4 days, I was getting ketamine. I am not sleeping. I'm in pain. But I stayed in hospital for 1.5 weeks. But on this day, I'm getting discharged. Hata nimechoka na hospitali, nimeamka asubuhi, nimepack. I want to go home. So this day, feeding, during this admission time, the whole time, I had a challenge with feeding. Normally with the medications, I've always had a challenge with feeding, but this time around, it was on an extra level. So the nurse came and told me, Jackie, you've not been eating well. Let me get you a yogurt, because we don't know how long this discharge process takes place. After taking the yogurt, now I started having pain for gastritis. I called the nurse, they got the medication, but still the pain is there. So I was in pain up to around maybe 12. So after 12, I puked. And I puked the yogurt that I had taken, not even digested. So for me, I was like, maybe this is what was affecting. I puked from 4 p.m. to 3 p.m.
And that's after puking, after having the yogurt?
9 p.m. Yes, no. Now I'm having this stomach pain. I don't know what it is. And I'm simultaneously puking and diarrhea. Sijakula kitu. So it's puking. By the time we are calling the doctor, because now this thing is imeendelea sana, nimeanza kupuke damu. So I had to be rushed back to hospital to be stabilized. They gave me medication, hydration. It was just gastritis. And they did endoscopy. My stomach was wounded. So I had to stay in hospital again for some days. Then I got home. Now I have this issue and now gastritis. No eating, it's just pole uji as now I get back. Then after here, I had an issue with my dental. It started becoming painful. So kwenda kwa dentist, akaniambia ni the wisdom teeth, they had not fully matured. But I was actually in so much pain. So kwenda kuangalia, they were like, we cannot extract them. It needs a surgery. So I'm back to hospital for a surgery. After the surgery, I recovered, but I'm still in pain. They had to extract another tooth. But now, when I discussed it with the doctor, he told me, we are not going to remove any other teeth. With fibromyalgia, there's also another secondary condition. It's called transgerminal something. You have pain in your jaws. So, and I've actually been experiencing that pain lately. It's not on the teeth. It's the jaw that gets painful and swollen. Now, I'm here with gastritis. Then I started having seizures. they were like, we need to investigate these seizures. What are they? Is it just a side effect of the medication, or is it something else that's coming? So I had to be admitted in December. They did the thorough investigation. Then they just found out that these seizures are triggered by the fact that I'm not sleeping, because I only sleep for like, the most I sleep is 3 hours. Yes.
Ever since you started having pain?
Yes. And sometimes you even go the whole night, you're awake, you're functioning the next day. There's no sleep completely. You take the sleeping pills, it's not working.
Why are you not sleeping? Is it because of the medication? Is it pain?
It's the pain, not medication. Medication actually is what knocks you out for some time. It's because of the pain. You don't sleep. So when we discovered, I started taking the sleeping pills. They did ketamine, and now started sleeping vizuri. Now this year in January, I just fell in my house, and I fractured my leg. It was not something that would have fractured anyone. It's because of my bones have become weak because of constant taking of the medication. The calcium in my body is decreasing. So I get a fracture. I've journeyed with it for 3 months, not going to the office. I'm just in the house, and I've recovered the fracture. And I even went home for Easter. I stayed for some time. Actually, this year has been a bit smooth. But now when I came back, I had done away with the orthopedic boot, with the clutches. I was walking, pole pole. I started having weakness on my legs from nowhere. I can't walk. I have now to get back to 2 clutches. I went back to hospital. The doctor was like, maybe it's because you've not been walking. We do physiotherapy, but even with physiotherapy, it was now getting weaker. I can even just stand and fall. So I had to see a neurologist again. Now seeing this neurologist, they said they do an MRI on my spine just to see what's happening. Yes, they found on my the lumbar part of the spine, I have something called mild degenerative disc disease. That means that the disc have worn out, and now there is the nerve is being touched by the disc, and it is causing lower back pain. But they told me it is not like strong enough to cause weakness on your legs. It's something very mild. So they told me they are suspecting I have another condition. It's called GBS. It's a very complicated word. It's just GBS. And what this condition is, it's your immune system attacking the nerves, any part of the body. So that day, they were holding me in hospital, and they're like, you need to be admitted for observation because we don't know if it can attack any other part of the body. So I was like, I don't have insurance, and being admitted here, it's expensive, and we don't know for how long. And I'm not even psychologically prepared to be in hospital. So they were actually concerned because I told one doctor, then I saw another one coming, are you sure you want to go home? Then I didn't know the severity, and they told me, no, this thing, it is progressive, and it can go to any part of the body. It can go upwards, but it can come to my face, you can't know. Their concern was it might get to the lungs, the respiratory system, then your lungs will not be able to supply oxygen, and that can be very fatal. Then I just told them, for now that I know the severity of this thing, let me just go home in case I see anything. Even if it's just a mild fever or anything, I have to come back. So we are yet there because I'm yet to see a neurologist on that, so that maybe they can start now investigating if it is that disease or if just this fibromyalgia messing up everything, because there are so many factors. Long-term use of medication, there's the fibromyalgia, so they cannot like really pin it on this one thing, but the symptoms are going to that side.
So first of all, that is a lot for one person. Yeah. Like, that is a lot. And you're such a good storyteller. That journey, I feel like every year, like, we've walked through it.
Yes.
we know what was happening. So question is, right now, do you still have the pains? You're still on painkillers?
Yes.
Gastritis? Still on soft?
One time, but imepungua this year. It's been a bit soft.
Can you eat anything, but you're still on soft?
No, like I have an issue with appetite. There are days I go without eating anything, and I don't feel hungry. But I'm a bit selective on what I eat. Sometimes I survive on bread. That's what the body can take. Because sometimes you eat and you pick everything.
So I'm just curious, like, how is Jackie feeling right now? Like, what does... I know you would want the pain to end completely, but how is Jackie?
Grateful. Yeah. You learn to be grateful for the small things in life. And being awake, having slept for a few hours, you're grateful because there are days you go without it. Yeah.
Well done.
Yeah.
Utapona, Aki.
Yeah.
We are going to pray for you, Jackie. I feel like your story is very... gives us a reason to be grateful as well. Yeah, we need to be... even for something as small as being able to sleep.
Yeah. Actually, I tell people sleep is a gift. And without sleep, it gets to a point your body will just shut down. So I tell people, I know this is a busy world and you want to work, but sleep. There's a reason why they recommend 8 hours of sleep. So sleep if you can.
Thank you so much, Jackie. Now that you wanted to, you reached out to me to have this platform and to give you a chance to say, if there's that one thing you really wanted to say, I want to give you that chance to say it. You've shared your journey. I feel like you are so detailed. Na feel your story too, from 2013 tangu ukiwa Nyeri, all the way to 2019 when it came back when you were in Mombasa. So I feel like the journey nime follow through. But is there that one thing when you are writing that email, ulikuwa unataka ku pass out, apart from the awareness bit of it? Is there that one thing unaweza taka tu kusema before we end?
Yes. We should learn to be grateful for the very thing that you think it's your right. It's a gift. And be kind to people, whether you know them or you don't know them. We are dealing with a lot. So the best gift is kindness. Yeah.
Thank you, Jackie. Thank you. And thank you for being such a strong lady. You're so strong. Thank you. Like, I can't even imagine the pain. That story, because I'm assuming socialization imekatika, kazi imekatika. Like, you can't even be you, because anytime pain inaweza tokea niende hosi.
Yes.
You're such a strong lady.
I have a strong support system.
Yeah. I'm happy to hear that. Naona hata mama kwa hapa. Yeah. Thank you, Mom. And we are really... personally, I'm going to be praying for you, like, sana. Yeah. And keep up that mentality. You're so positive. Like, you're so positive. The fact that unaenda hosi unaambiwa na daktari, ingia, you don't fight them. Wanakambia you are doing this, unakubali. Keep up that mentality. Like, keep up being positive. Yeah. Itakuwa sawa. Yeah.
It will come to an end one day.
It will. Yeah. It will. Thank you so much.
Thank you.
Thank you so much, guys, for watching. Is there anything you would like want us to, in case someone wants to, is there anything you would like unaweza taka to display? Not your contacts, nothing.
Maybe sorry. Maybe there's someone out there who needs someone to talk to. You can call me.
Or someone who is in such a...
Yes.
You're willing to even... Oh, wow. Like, you're even willing to... That is so good. That is so good. Thank you, Jackie.
Thank you.
Thank you, guys, for watching. We'll see you next week. Bye-bye.